Hi Luke, my name is Hannah. I'm going to be your nurse for this physical exam. Is it okay with you if I video this exam and send it to my instructor for grading?
Absolutely.
Okay, great. First I'm just going to wash my hands. As I'm doing this, I'm taking a look at your overall appearance, your skin characteristics, skin tone, all that good stuff. How have you been feeling?
Fine. Feel good.
Having any health problems lately?
No.
No? Anything you need to tell me before we get started?
I don't think so.
Okay. Very good. So is it okay with you if we remove the glasses?
Sure.
Thank you. So I'm taking a peek at your face. Okay, I'm going to take a peek at your hair and your scalp. Hair looks nice and shiny and healthy. I don't see any wounds or sores or anything, and I'm just going to kind of palpate your scalp here. Does anything hurt?
Mm-mm.
Very good. Okay. I'm going to feel for your temporal artery. Good. And then feel for TMJ. I'm going to have you open up your jaw and close, and open up and go side to side. Very good. Okay. I'm going to palpate your sinuses. So let me know if anything is uncomfortable, if any of this hurts.
No.
Okay. And your nose is nice and aligned. Can you close one nostril for me and breathe in and out? Good. And do the other side. Thank you very much. And can you wrinkle your forehead? Wrinkle. And can you smile for me? Can you frown? Can you pop out your cheeks? Great. Don't let me push them in. Thank you. Alrighty, so I'm going to have you just open up your mouth for me, please. I'm going to take a peek inside. Alright, everything looks nice and pink and moist. Can you stick your tongue out? Awesome. Can you say ah? Ah. Thank you. Very good. Alright, can you smile? Show me your teeth. Great. Awesome. Very good. So I'm going to have try to pull your jaw down. Don't let me. Great. And I'm also going to have you turn your head left to right, go down and up, and then I'm going to have you go ear to shoulder and then ear to shoulder. So I'm going to have you do that for me, please.
Okay.
Down and then up, left and right. Great. And then ear to shoulder on each side. Very good. And can you shrug your shoulders for me? Good. So I'm going to put some resistance against your head and have you go forward and back, left and right, and then ear to shoulder again. So I'm going to have you look left. Good. And I'll look right. Good. Put your head forward. Pull your head back. Okay. And ear to your shoulder on the inside. And shrug your shoulders for me. Very good. So trachea looks nice in midline. I'm just going to palpate your pulses in your neck here one at a time. And I'm also going to feel for some lymph nodes. Is anything sore or uncomfortable? Okay, very good. Alrighty, so I would like to have you sit up in the chair for me. I'm going to palpate your thyroid, however is comfortable for you. Thank you. So I'm going to just feel your neck here. And I'm going to have you swallow. And swallow one more time. Great, thank you. Okay, and I'm going to have you actually kind of sit around in the chair the other way so that I can. Perfect. Okay. So I'm taking a peek at your back, checking for symmetry and respirations. Are you having any difficulty breathing?
No.
No. Does it hurt anywhere that I touch?
No.
Tell me if it does.
Okay.
Spinal processes are good, nice and prominent. Okay. And I'm going to have you take a deep breath in. One more time. Very good. Okay. And I'm just going to percuss over your kidneys. You let me know if you feel any discomfort anywhere. Does that hurt?
No.
Alrighty. I'm going to take a listen to your lungs, and I'm going to be listening over many areas. So if at any point you get lightheaded or dizzy, I just want you to let me know, okay? You can put your hand up or say something if you want. So nice deep breath in and out. Okay, everything sounds really good. So I'm going to have you just come back around, sit here for me. Alright, great. Before I move too much further into doing cardiac, I'm going to listen a little bit more on the front of your chest for your respirations. And then I'm going to do some eye exams and stuff like that, just letting you catch your breath. I don't want you getting too dizzy on me. Okay. So I'm going to listen to the front. Very good. Nice and clear. Okay. So I'm going to have you do a couple of eye exams here with me. Normally, if we were in the hospital, we would be doing what's called a Snellen test, and it's one of the papers that's up against the wall, and it has the big letters, and it goes all the way down to the smaller letters. And if you're able to read that at 20 feet away, you would have 20/20 vision, but we don't have that here. So I'm going to have you read a line from a magazine. I'm going to have you cover your right eye, and then I'm going to have you cover your left eye separately. Read a sentence with each, and hold that about 14 inches away for me, please.
40% of you say the idea of a perfect vacation is a road trip.
Great, and then I'm going to have you cover the other eye, and read about 14 inches away.
Go kayaking in Moss Landing to see humpback whales.
Very good. Thank you very much. Okay. So I'm going to check your corneal reflex. Awesome. Very good. And I'm just going to have you kind of stare at me. Good. I'm going to have you stare back at the wall there. Just checking your pupils to see if they're reactive and accommodating. And so I'm going to have the light off because I know that's awfully bright. I'm going to have you follow the pen light with your eyes, but not move your head. Okay. All right. Awesome. Alrighty, and then I'm going to have you cover one of your eyes. Okay, I'm going to cover this one as well. I'm going to hold the pen light with the pen light off, and I'm going to bring it into your peripheral view, and I want you to say now when you start to see the pen light, okay?
Now. Now. Now.
And I'm going to have you keep that eye covered. Do that again.
Now. Now. Now.
Great. We're going to cover the other eye. I know, kind of blurry, huh? Tell me when.
Now. 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 Now.
Great, very good, okay. So just kind of taking a peek at your eyes here, making sure the sclera is nice and white. Very good. Can you blink for me really hard? Great. Very good. Okay. Alrighty, so we're going to put that pen light away, and I'm going to do what's called a whisper test. I'm going to have you cover your, actually, you know what, I'm going to take a peek at the external ear first, then we'll do the whisper test. Okay. So I'm just pulling on your ear here and pushing down. Does any of that hurt?
No.
Good. Same thing on this side. Let me know if anything is uncomfortable. Does that hurt?
No.
Okay, good. Alright, so now we'll do that whisper test. I'm going to have you cover your right ear for me, please. And I'm going to whisper something to you, and I just want to have you repeat it back to me, okay?
66 snowboarding.
Great. I'm going to have you cover the other ear.
13 nursing school.
Very good. Okay. Thank you very much.
You're welcome.
Okay, so what we'll do next is I'm going to have you kind of swing your legs up so that you're lying down in somewhat of a 45-degree angle there, as best I could kind of get it. Okay. So I'm just going to inspect your neck. I'm going to just try to move one of these pillows, just see if I can have you lying back a little bit more. Okay. All right, that seems a little bit better. So I'm just inspecting your neck, checking for jugular vein distension, any pulsations. Looks good there. Everything's good here. I'm just going to kind of feel. Good strong carotid pulse. Good. Good strong pulse. Okay. All right. So I'm going to take a listen to your heart next. I'm going to first listen to your apical pulse and listen for 15 seconds, multiply that by 4, and I'm going to have you, when I first start listening, I'm going to have you count to 15 and put your hand up at 15 seconds for me, okay, because I don't have a watch. Okay. So your pulse is about 50-52. It's fairly slow, but is that normal for you? Have you been told you have a slow pulse?
Normal for me, yeah.
All right, very good. So I'm going to take a listen to your heart in a couple different areas, and normally I would listen with the diaphragm of my stethoscope, which is one side, and then I would listen with the bell, which is the other side, but my stethoscope only has one head, so I'm just going to listen with that, okay?
Mm-hmm.
And I'm just going to have you lean on your left side a little bit for me. gonna have you go back onto your backside there for me. Great, very good, okay. So next I'm going to inspect your belly. And normally in a hospital setting we would have you in a Johnny so I could take a peek at your skin and everything, but for the sake of the video, we've got the t-shirt and shorts on, so I'm going to inspect for symmetry and any abnormalities. Everything looks good. I'm going to move a couple of these pillows just to see if I can have you laying a little bit more flat, but I want you to let me know if it's too flat, too uncomfortable. There. How's that?
Good.
Is that okay for you?
Mm-hmm.
All right. So, have you had any difficulties with your bowels?
No.
No? When was your last bowel movement?
This morning.
Good. Was everything normal for you?
Normal.
Okay. So first I'm going to listen in your right lower quadrant, work my way around, and then I'm going to percuss, then I'm going to palpate. And I want you to let me know if any of it is uncomfortable for you. Everything sounds nice and normal, active, and I'm going to palpate. And I'm just going to feel, and if anything is sore, just please let me know. Okay, very good. How's everything feel?
Good.
Okay, good. So next I'm going to check your hips. If any of it is uncomfortable, let me know. Okay, all right, very good. So I'm going to have you bring your left leg up and towards your head. Good. And I'm going to have you do the right leg. Good, very good. I'm going to have you bend your left knee and kind of bring it up. Good. And back down. And same thing on the right side. Good. I'm going to have you try to push up on your left thigh. Good. And on the right. Okay. So bend your left knee up again for me. And I'm going to have you just kind of rotate it out and then rotate it back in. Good. I'm going to have you straighten your leg. Keep it out. And I'm going to have you rotate it over your right side of the body that way. And then back out. Abduct. Great. Thank you. And I'm going to have you do that same sequence with your right leg. Bend up. Rotate out. Back in for me. Good. Bring your leg back out again. I'm going to have you bring it out and then back over your body. Okay, very good. Have you rest your leg right down. So I'm going to take a peek at your skin, kind of feel temperature-wise. Keep you covered. All right, your toes are a little cold.
Mm-hmm. It's chilly.
Okay. All right, I'm feeling for edema, which is swelling, and I don't see any. So I'm going to palpate your pedal pulse. There it is. I'm going to feel for another pulse in here. And on this side. I'm going to feel for your popliteal pulses behind your knee. All right. There we go. Okay, I'm going to bring your leg back out again. I'm just going to bring this up just a little bit. And also I would normally feel for a femoral pulse kind of within your groin, but for the sake of video, we're not going to do that today. Bring your leg back out for me. Great. All right, I'm going to have you kind of fan out your toes bilaterally for me. Wiggle them around. Very good. I'm going to have you bring your feet up and push down, and then I'm going to have you bring them up again against my resistance. Good. And back down again. Very good. Just checking in between your toes. Everything looks pretty decent. And just feeling for capillary, checking for capillary refill, making sure you have good circulation even though your toes are cold. Can you feel me touching your toes okay?
Mm-hmm.
Your feet are okay?
Mm-hmm.
All right, very good. And I'm just going to have you bring your kind of feet out like this and then back in without moving your knees if you can. Good. And then back in as best you can. Great. So normally I would check for what's called a Babinski reflex, where I bring something up the lateral side of your foot and over your toes and check for reflex. But do you want me to do that?
Sure.
You do? Okay. So I'm going to use my thumbnail. There we go. Sorry, I know you don't really like your feet touched. And I use my thumbnail again. Okay, all right. Sorry, I know you don't really like that. Alrighty, so I'm going to have you kind of sit up on the edge of the bed there for me, please. All right, and I'm going to have you scoot back a little bit just so your feet are kind of dangling. And I'm going to use the head of my stethoscope here to check your patellar reflex. Okay. And again on this side. Okay. While I have my stethoscope, I'm going to take one more listen. I'm going to have you lean forward for me. I'm going to have you exhale and hold your breath for a moment. All right, very good. Go ahead and catch your breath. All right. Not dizzy or lightheaded or anything?
No.
Very good. So, I'm going to kind of assess your arms here. Check for radial pulses, check your hands and all that good stuff. So I'm going to do your left arm first. Okay. Hands are nice and cool and pink. I'm going to feel your radial pulse here. I'm going to feel for your brachial pulse. Okay. And now I'm just feeling for any swollen lymph nodes. Any pain or discomfort while I palpate?
No.
Okay, and have you bring your arm up for me. Good. Push against me. Okay, then pull back. Alrighty. And your nail beds are nice and pink. Good capillary refill. You bring your fingers out and in, and then squeeze 2 fingers. Great. Alright, and as I feel around in your hand and wrist, are you having any pain or discomfort?
No.
Okay, great. So I'm going to take a peek at this side as well. Kind of doing the same stuff as I did on that hand. Let me know if anything is uncomfortable for you. And for your brachial now. Just feel it from it. Very good. All right, I'm going to have you squeeze 2 fingers here. Good, nice and strong. I'm going to do it equally now at the same time. Squeeze. Great. Okay, can you clench your fist like this? All right, and I'm going to have you relax. I'm going to have you bring like this and pull against me. All right, and then push against me. All right, very good. Okay, so arms look good. We're going to test your range of motion. We had done the shoulder shrug and all that earlier, but I'm going to have you bring your arms out, kind of in front of you there. Cross your arms over each way. Oh, good. And bring them up and over your head. Okay, and bring them back down over. And then behind you, with your palms facing up and your wrists cross over. Good, you're able to do that okay? Any pain or discomfort in your shoulders? Okay.
No.
Great, I'll have you bring your arms back down again. And I think what we'll do now is have you stand up for me. Okay. And I'm going to have you walk over to the door normally and walk back towards me doing heel to toe. Good, come back this way. Heel to toe. Good. And then I'm going to have you turn around and walk back to the door on your tiptoes and come back on your heels. Very strong calf muscles. Okay, great. And then I'm going to have you step away from the bed a little bit. I'm going to have you get on one knee, or one leg, excuse me, not one knee. One leg. I'm going to have you bend slightly at the knee and then back up. And then I'm going to have you do that on the other side, please. Bend down a little bit, back up. Very good. Now I'm just going to have you breathe normally. I'm going to have you close your eyes. And I'm going to check your Romberg test to see if you sway at all. So I'm going to check that for about 15 seconds. I'm here if you get dizzy or lightheaded, let me know. Very good. So I'm going to have you have a seat again, please. And I'm going to have you put your one hand out, your left hand, or excuse me, your right hand, whatever one you want to do. I'm going to have you do left hand since I said that first. And I'm going to have you close your eyes. I'm going to put something in your hand, and I want you to tell me what it is without using your other hand, just one hand.
Paperclip.
Very good. All right. Now I'm going to have you keep your eyes closed, and I'm going to have you put your right hand out for me, and I'm going to put something in your hand. I want you to tell me what it is without using your left hand.
A nail file.
Very good. Okay. Keep your eyes closed for me, please. I'm going to touch you with a cotton ball, and I want you to tell me where I'm touching you, please. Okay?
On my forehead.
Okay.
My neck. Left arm. Right arm.
I left some cotton on your neck. I'm going to pick that off. Got cotton in your stuff. Keep your eyes closed. All right. I'm going to touch you again. Tell me where I'm touching you.
Left foot.
Great.
Right hand. Right elbow. Right foot.
Okay. Very good. All right. You can go ahead and open your eyes for me now. And I'm going to have you close your eyes again, please. I'm going to do another test on your finger. I want you to tell me which way I'm pointing your finger, okay?
Up. Down. Up.
And now on your right hand.
Up. Up. Down.
Okay, very good. Alrighty, Luke. I have just a couple questions. Are you having any pain or discomfort or anything right now?
No.
Do you have any questions for me?
No, I don't.
Okay. So I want to thank you for participating in this exam. I
You're
appreciate your
welcome.
time. And I hope you have a great day.
Thanks, you too.
All right.
Bye.
All set.